I think one of the big things about following surgery and that journey for the patient is that it only works if we can put into practice some long-term sustainable behaviour change, which will result in a really good result if people can change how they eat and how they move and what they do. And as a Chinese proverb says, the journey of 1,000 miles starts with a single step. And I think my real approach to this is to boil that down to small, sustainable, realistic goals, things that the patient can put into place and really get some friction and traction on making some changes to their life. And if we can add one little change to another little change to another little change, then we see success and we see journey. I think the other tip and trick that we talk about is the fact that any journey of growth and change has setbacks. And often we can think about setbacks as failures, but actually setbacks are a great opportunity to learn and to think and to grow and to actually learn more about ourselves and how we function. And I think my role as a physician on the team is to really have a look at what happens with setbacks and to be able to use them as a really good learning tool to be able to motivate the patient to go back to grassroots and think, well, what's the next step I can make towards my health and wellbeing journey? The other thing I've had some great success with and I've got some extra expertise in is really unpackaging the unhelpful thinking patterns around our weight and around our eating patterns and just that whole how we handle food in stressful situations. And so some of my other approaches is actually to look at those thinking patterns, and I've got some great strategies that I can help the patients with to really think through how to not let those unhelpful thinking patterns sabotage their journey and how they can actually make action coming from that core value of a health journey so that they can go towards their goal of managing this problem, of having a life where they can bring their best to their relationships, where they can feel good about themselves, where they can be healthy. And so that when it boils down to it, we work at really practical steps, little small goals, and over time we see we get where we need to go. And that's really satisfying for the patient and a great reward for us as medical practitioners to see that happen.